Caring for burn wounds is essential to promote healing, prevent infections, and minimize scarring. Burn care varies based on the burn severity and the environment, home versus hospital. This guide provides detailed care instructions for both minor and major burns, as well as specific practices followed by nurses in clinical settings. For minor burns, first degree and superficial second degree, home care can be effective. Start by cooling the burn under cool running water for 10 to 20 minutes. Avoid ice, as it can damage skin tissue. After cooling, gently pat the area dry and apply an over-the-counter antibiotic ointment like Neosporin or a burn-specific gel with aloe vera. Cover with a non-stick, sterile bandage to protect the area from infection and keep it clean. For fresh burns, avoid showering or submerging the area in water for the first few days to prevent softening of the wound and increased infection risk. When showering, cover the burn with a waterproof dressing if possible, or seek guidance from a healthcare provider. For smaller, closed minor burns, gentle washing with mild soap and water after a few days may be acceptable but should be done carefully to avoid disrupting healing skin. Infection prevention is crucial for all burns. Keep the wound clean and dry, change dressings daily, and wash hands thoroughly before touching the wound. Avoid popping blisters, as they form a protective layer against bacteria. If signs of infection, like redness, swelling, or pus, develop, seek medical attention promptly. Over-the-counter antiseptics may be used sparingly, but avoid alcohol-based products as they can irritate the wound. Minor burns can be painful, especially in the first few days. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, help reduce pain and inflammation. Cool compresses and topical gels with aloe vera or lidocaine can also soothe the area, but avoid strong anesthetic creams unless recommended by a doctor. Major burns, deep second degree and third degree, require specialized care. In hospitals, nurses play a critical role in cleaning, dressing, and monitoring burns to prevent infection and promote healing. Nurses begin by carefully assessing the wound and then using saline solutions or specialized antiseptics to clean the area, avoiding any products that could delay healing or damage tissue further. For severe burns, nurses use non-stick, sterile dressings designed to maintain moisture and protect against infection. Dressings like hydrocolloid, silicone-coated, or silver-impregnated dressings are common, as they offer antimicrobial protection. Dressings are changed frequently, with nurses carefully removing them to avoid disrupting healing tissue. Pain management is critical during dressing changes to ensure patient comfort. Hospitals follow strict protocols to prevent infection in burn patients. Nurses wear gloves, masks, and sometimes gowns during dressing changes, and all tools are sterilized. Silver-based dressings or creams like Silvadene, silver sulfadiazine, are applied to control bacterial growth. Nurses monitor the wound for any signs of infection, such as increased redness, swelling, or fever, and follow a protocol to address infections quickly. Ointments play an essential role in keeping burn wounds moist and infection-free. For minor burns, antibiotic ointments like Neosporin or bacitracin are used. In hospitals, Silvadene cream, which contains silver sulfadiazine, is widely used for its antibacterial properties in deeper burns. Other options include honey-based dressings and aloe vera gel for soothing, but usage depends on burn severity and healthcare provider recommendations. Blisters should generally be left intact, as they protect underlying tissue. In cases where blisters must be drained, only medical professionals should handle this to reduce infection risk. To reduce scarring, nurses may apply silicone sheets, scar creams, or compression garments once the wound has sufficiently healed. Proper hydration and a balanced diet also support tissue repair and minimize scarring. Even with diligent home care, burns that show signs of infection or are slow to heal should be evaluated by a healthcare professional. Burns involving joints, hands, face, or genital areas may require specialized care to prevent long-term complications. Severe burns require immediate medical attention, as improper care can lead to serious infection or long-term disability. In hospitals, patients with burns are carefully bathed to maintain hygiene without harming the burn site. Water used for bath is specially treated to kill any bacteria. Nurses may use sponge baths or specialized burn baths with antiseptic solutions. Showering may be permitted once the burn is covered and healing, but the process is closely monitored, and water temperature is controlled to avoid disrupting fragile tissue. The process of burn healing can be emotionally challenging. Patients often experience anxiety or depression, especially with visible or painful burns. Nurses and caregivers provide emotional support and encourage engagement in recovery programs. Counseling and support groups are also beneficial in helping patients cope with physical changes and trauma. Long-term care focuses on preventing contractures, tightened skin that restricts movement, maintaining mobility, and reducing scarring. Physical therapy may be recommended for burns on joints to ensure full range of motion. Once the wound is fully healed, scar management techniques, including laser therapy, pressure garments, and specialized scar creams, help improve skin appearance and flexibility. Proper nutrition supports wound healing, especially in severe burns where protein and calorie needs increase. High-protein diets and vitamins such as A, C, and E, along with minerals like zinc, are essential for tissue repair. Hospitalized patients may receive nutritional supplements or enteral feeding to meet their increased metabolic demands. Many myths surround burn care, like using raw egg whites or butter on burns. These can increase infection risk and delay healing. Studies have shown that basic care methods like cool water and antibiotic ointments are more effective and safer. Understanding these myths helps patients make informed choices and avoid risky treatments. For minor burns at home, keep the wound clean, covered, and hydrated with recommended ointments. Avoid tight bandages, and replace dressings daily. Watch for any signs of infection and seek medical advice if the burn worsens. Following these simple steps can ensure a safe and effective healing process. Proper burn wound care is essential for recovery and minimizing complications. Whether at home or in a hospital, understanding the right techniques and avoiding common mistakes can make a significant difference in healing outcomes. With attentive care, even serious burns can heal with minimal scarring and discomfort. Thank you for exploring the steps to effective burn care. By following these guidelines, patients and caregivers can ensure the best possible outcome and promote a healthy, smooth recovery journey.